Prepper Midwife channel. I'm going to be talking today about how to prepare for a home birth. I'm going to talk about the absolute must-haves, the would like to haves, and the nice to haves. So, what you absolutely must have is a mom and a baby. Everything else is not absolutely necessary, but really helpful to have. So, and also really important if you're attending a woman in labor is the right attitude. So birth, by and large, is a normal event, and we really don't need to interfere in it. It's helpful to have some skills, it's helpful to have some things, but the most important thing to have is a positive attitude and the understanding that quite often when we interfere, we make things worse rather than better. So it's always important to keep in mind that first, you don't do any harm. And we're going to talk about on this channel what's normal and what's not normal. And many times when we talk about what's not normal, people internalize that and they forget what's normal. So I really hope that you can take away from this that birth is a normal event. It's just a normal part of any person's life. The majority of women will give birth at some point in their life, and we need to keep that in mind. Up until recently, birth has been always happening in the home with the attention of either midwives or female family members, sometimes neighbors, occasionally a woman on her own or with her husband, but the majority has been community birth. And part of what I'm trying to do with the Prepper Midwife channel is to help people bring birth back into the community. For now, while the world is still in a relative state of normalcy, and also if things get worse. So I have some things laid out here that I normally take to births, and I'm going to talk about them and some other things that I recommend mothers have on hand for the birth. So this may seem like a very odd item to have, but it's actually incredibly handy. These large plastic tablecloths with the cloth backing are really helpful because you can lay them out on any surface and suddenly you have a large, clean, not sterile, but clean surface. And that's really helpful if you're in an environment where things are not great, where you don't have necessarily clean bedding and towels and everything. So having one of these in your birth kit is super handy. Towels are also super important to dry mom off or dry baby off, keep mom warm. Either a combination of bath towels and washcloths. Washcloths are helpful for, of course, cleaning up afterwards, and also if mom wants warm washcloths and there is clean water available, supporting the perineum with a warm washcloth. And other things we have here, blue pads, easy to get at any pharmacy. They're great because then you can throw them out once you're done and you can control any mess. Birth is not a dirty event, but it does involve blood and fluids, and if you don't have the normal abilities we have today to clean everything up, it's very helpful to have some disposable items. And we also have some baby diapers and Depends. Depends are amazing for after the birth because you don't have to worry about leakage. I also recommend the moms I work with have a roll or two of paper towels and trash bags just to collect all the disposable and get rid of it in a sanitary fashion. If you're in a situation where we don't have the regular garbage pickup that we normally do now, burning everything would be the best option, simply so that animals don't get into the trash and make a huge mess and contaminate things. Something that I didn't mention yet, but I really should have, is gloves. Because you're dealing with blood, amniotic fluid, it's really important to wear gloves because while you may know the person that you're helping with, it's always a good idea to use precautions and personal protective equipment. And it's not just helpful for you, it's also helpful for baby. I try very hard to never touch another person's baby with my hands because I know that the baby's microbiome is just being developed, and I want that baby to be colonized by mom and dad and siblings bacteria and not mine, because it's not my baby. So that's why I wear gloves, in combination with the necessity of protecting myself and the parents from any bloodborne pathogens. But it's really important to have gloves in your birth kit. Also, sterilized scissors for cutting the cord after the birth. It's important to let the cord wait to finish pulsing. So just remember, wait till the cord is white and floppy. You don't want blood flowing back and forth through the cord when you cut it, because that blood belongs in the baby. It doesn't belong in the placenta. It doesn't belong on the floor. It doesn't belong in a blood bank. That blood belongs in the baby. The baby has up to 1/3 of its blood supply still outside of its body when it's born, the majority of that being in the placenta and also cord. And the blood needs to come out of the placenta and get into baby so baby has the best start in life. Otherwise it starts off life anemic, and that's not something you need. You also need a sterilized cord tie or cord clamp. Somewhere in here. We've got everything jammed in here real tight. So this is a type of cord tie. It's a loop that goes around the cord. You also can get plastic clamps and or cloth ties, which would be sterilized. Any of those work. In a really difficult situation, I suppose you could use a clean cord, like some people will crochet wool into a tie. You just have to make sure it's tied very tightly so that there's no leakage from the cord. Sterile gloves are very helpful, as well as regular gloves. Sterile gloves would always be used if mom's water has broken or there's doing anything internal. But as somebody who's not, if you're just seeking to help in the community, you're probably not doing anything internal because you are not trained for it. Also, alcohol and alcohol prep pads are handy. I use alcohol prep pads to clean up my equipment afterwards, stethoscopes and whatnot, but also I keep a bottle of alcohol with to clean the birth stool after washing it down with soap and water. A peri bottle is a super handy thing to have. Not an absolute necessity, but it makes life much easier afterwards for mom because she can use water for cleansing, especially if she's had any minor abrasions or tears. That is much more comfortable. Or during, like once baby's born, if they have a lot of mucus in their mouth and nose, you don't want to routinely use a bulb syringe because it can, used aggressively, it can make baby not be inclined to want to nurse. It's strictly for use if baby is very congested, very full of fluids. You've tried to drain the baby by postural drainage, which we'll talk about later on as part of resuscitation. So use the bulb syringe only when necessary. Here we have some herbs. Angelica is a really amazing herb. We typically use it at the, if mom is bleeding more heavily than she should and her placenta isn't still inside, Angelica helps the placenta come out. It also promotes mom's normal oxytocin levels, so it helps her body do what it's intended to do. It's not like a pharmaceutical drug that's forcing something on the body. It's supporting the mom's system to do its own job. And that's what we're doing with herbs. It's supporting the body so it can do its job better. We also have yarrow tincture. Yarrow is an amazing herb. In this case, we're using it as a hemostatic. So it helps generally anywhere in the body, but it does work well also on the uterus. That taking the yarrow tincture by mouth helps to stop the bleeding. We also have shepherd's purse tincture, which I use very carefully in that it can cause larger clots. So shepherd's tincture is something that you only use in women who aren't clotting well on their own to help them promote their own clotting. Another tincture that I don't have here on the table, but I do often use, is cotton root bark. Unfortunately, it's not something that grows here in Canada. It's too cold here. But it's important to get organic cotton root bark tincture, and it's important to tincture it fresh. So I tend to buy from Wish Garden Herbs simply because I don't have cotton root bark growing here. And buying the dried herb does not make nearly as effective a tincture. So cotton root bark supports the woman's natural oxytocin, and it's a phenomenal herb to use to help the uterus contract properly if there's any excessive bleeding. We've also got a fetoscope here, or a Pinard horn rather, for listening to baby in labor. A couple other things. We've got a more milk tea. These are the nice to haves, which helps mom to, if she's having issues with producing enough breast milk, because in a situation where things are not normal, breastfeeding is super important, because we know from even the last year there's been formula shortage, and there's still formula shortages here. Almost weekly I see somebody in a mama's group saying, hey, I can't get this formula. Do you know if I can substitute it with something else? So breastfeeding is super important for babies. It's not just the best nutrition possible. It is literally life and death in some situations. Bendy straws, not super important, but really nice to have. And postpartum herbal sitz bath can either be used in a bathtub or in a sitz bath basin. Helps healing of the tissues after the birth. We've got a sling and scale here. So basically you lay baby in and you put the sling on the scale and you weigh the baby that way. In most cases, it's a nice to have. In rare cases, when baby's not growing well, it is actually very helpful to know whether baby's gaining weight or not. Here we also have a birth stool, another really nice to have, and a bowl for the placenta. Some type of container for the placenta is kind of necessary. This birth stool is purpose made, but you can also use things like a squatty potty or maybe a chair that you modify. The reason I like birth stools a lot is for after baby is born, having mom birth the placenta on the birth stool is super helpful. Because if you think about it, after the birth, mom tends to be she did a ton of work. She doesn't want to have to get up and squat to get the placenta out. And it's not super helpful to try and birth a placenta laying down in bed. Because if you think about it, the internal of mom's pelvis goes up like this when you're laying down. The force of the uterus will push a baby uphill. It's not comfortable, it's not ideal, but it can happen. The uterus is now much less full and the placenta has a harder time going up the hill. Some women, their uterus is like super strong and it just like comes out, no problem. But especially in a longer labor with a mom who's more depleted, she just may not have the energy. So having a birth stool is super handy to be upright and just let gravity do the work. Since I've had a birth stool, I've absolutely loved it. We've used it for many things, including first-time moms. They tend to give birth much better on a birth stool than in some other positions, just because their bodies need a little bit more time, and they don't know what they're doing yet. So muscle memory is a big thing, and when you've had 6 kids, usually the baby will just come out easily. You may not even want to use a birth stool because that might speed things up too much. But in a first-time mom, that position can be very helpful, because quite frequently when we haven't had children, the only time that we've ever fully relaxed our pelvic floor is when sitting on the toilet. And it's a similar position to sitting on the toilet. So it's a great way to subconsciously get our bodies to do what they need to do. So that is a very brief look at what you might need at a home birth. We're going to talk more about some of these items. We're going to talk more about other items, but for today, that's what we're going to cover. Thanks.